Okay, now we're going to hear from Jacob Manning of the Small Business Association of Michigan. Welcome, Jacob.
Thank you, Chair Bagol and members of the committee. My name is Jacob Manning. I am the Advocacy and Policy Manager for the Small Business Association of Michigan, also known as SBAM. SBAM is proud to represent over 33,000 members across all 83 counties and in virtually every industry in the state. Our mission is the success of Michigan's entrepreneurs, and that includes all of Michigan's entrepreneurs. Our membership represents only a small share of the more than 1 million small businesses across the state that drive a bulk of the economic activity in our state in most of our communities. Nearly 80% of Michigan's private sector employment is from businesses with fewer than 500 employees. Over 50% comes from businesses with fewer than 100 employees. So again, Michigan's economy is driven by small businesses. And through our work with our members, we see a clear view on what we view as a worrying trend. And that is, of course, something we've been talking about throughout this committee hearing today, and that's the rising cost of healthcare. And we're specifically concerned with what it's doing to our employers and their employees. This won't surprise many of you who talk every day with the employers and employees in your communities and hear about the human costs of these year-over-year double-digit increases. And these are year-over-year increases applied to an increasingly large number each year. And this is a problem that's been building for a while. It's been accelerating post-pandemic, but it's now at a crisis point. We do quarterly member surveys where we try to get a feel for what's going on at the ground level. This is feedback from people with skin in the game. And all the time through these surveys, we hear about the trends months, sometimes even years before they reach the public consciousness. According to our most recent member survey, which was conducted this spring, 42%, nearly half of respondents say that if healthcare cost increases continue, as they have been, it will be only 1 to 3 years before they are forced to consider dropping insurance coverage entirely for their employees. And some have already made this decision. It's easy to think about this as just a statistic, but I want to think for a moment about what it's like for the businesses that are having to make this excruciating decision for their employees who are like families to them. Their team is their family. Oftentimes they are literally part of their family, but this is their second family. It's not a decision that employers are making lightly, and it's not one that they're making because they want to, but they literally cannot avoid it because they are seeing increases of $2,000 per employee per year. And while this is just a sliver of the overall experience going on in Michigan's economy, I assure you that these decisions are being made in your communities as well. So who's to blame for these increases? We're not going to be pointing fingers at one specific group. There's not just one actor in the system that's causing prices to go up, nor is there one bad guy acting to make everyone's life worse. If there were, it would probably make solutions a lot easier. But the current system cost increases are compounding, and year over year, there's no relief in sight. So the concern that we're here talking about today is, of course, hospital systems. We see the effects all over the state of this ongoing arms race between health systems. Systems are consolidating and absorbing competitors at a rate that we've never seen before. Hospital systems are racing to build new facilities that expand their footprint, and you may expect this to result in lower prices through competition, but every new massive investment has to be paid back, of course, and every new merger leaves fewer players at the table, and this means more leverage for those who remain. We've found that over the last handful of years, these practices have increased costs of hospital care, which make up nearly half of the premium that small businesses are struggling to pay every month, the same premium that I discussed just a paragraph back. We do understand, of course, that this package of bills is aggressive, but we view it that it is time to treat this issue as an emergency because that is what it is. We applaud Speaker Hall, Representatives Harris, DeBoyer, and Aragona for proposing a solution that is aggressive. It takes aggressive steps to lower costs, and while we don't expect this to be a finished product by any means, as Brett just talked about in his testimony, we look forward to working with the sponsors on their bill, and truly, we look forward to working with anybody who's interested in solutions that lower premiums for small businesses that could be hospitals, insurance companies, pharmaceutical companies. Everything is on the table because for small business owners, the only thing that we can't continue to live with is the status quo. So with that, I welcome any questions from the committee, and I thank you for your time.